My speech is on the taxes of Obamacare. The new tax-related provisions in Obamacare include tax hikes, limits to deductions, tax credits, tax breaks, and other great changes. The Congressional Budget Office has proved that the revenue generated from the new taxes will help pay for the Affordable Care Act's many provisions and fund tax credits and lower the deficit. The deficit basically means when the amount of a sum of money is too small. Obamacare expands access to affordable health insurance to almost 50 million low to middle income men, women, and children across the country by offering reduced premiums via tax credits and by expanding Medicaid. Even though there are new taxes, the 85% of Americans that have health insurance but make less than $250,000 shouldn't be affected by the new taxes. Small businesses with fewer than 25 full-time employees who make less than $25,000 in average annual wages will still have access to tax credits to reduce premium costs of group plans. Also, there are premium tax credits that are a form of cost assistance that help reduce the premium cost for coverage. So overall, the benefits tend to outweigh the cost for the average American.
After all that I said, I want to talk more about how Obamacare affects doctors and their rates. Statistics show that 60% of more than 5,000 doctors surveyed said that the Obamacare law would have a negative impact on patient care. Doctors are already unavailable because of their patients and work for Medicare and all the other healthcare options. What's the difference with Obamacare? Some people may ask if they can have the same doctor they have always had. No section of the Affordable Care Act does it say that you cannot keep your doctor, but it is up to your provider to determine the network of doctors and hospitals you have access to. Obamacare has been a law passed since 2010, and people still are not agreeing with it. Taxes. Taxes is another major argument to the opposing side of Obamacare. People will pay more taxes to fund and operate the Obamacare law. Obamacare is paid for by collected taxes, penalties, spending cuts, and reformations to the health industry. Cost assistance to Obamacare is only given to low to middle class Americans who shop on the health insurance marketplace, which is where you go if you don't have coverage through a job, Medicare, Medicaid, and children's health insurance program. This helps you find, which also helps you find and enroll in a plan that fits your budget and meets your needs. If you are able to cover your own health insurance, you wouldn't get cost assistance and would most likely pay more taxes than most. All these taxes are taking money away from payments for jobs in the government, which the U.S. isn't in enough debt already. Obamacare can delay your tax refund because say you couldn't afford health insurance and choose not to buy it at all. Generally, you need to pay a fee known as the individual shared responsibility payment when you file your tax return. This has a very big impact on the people who need it the most. Did you know that because of the Affordable Care Act, all U.S. citizens and legal residents will be required to have health insurance for an entire year, even if they didn't want it? This may result in your tax refund to be lower. There are a lot more options for healthcare. Why add another healthcare option that most likely won't benefit most people? The House of Representatives have voted to repeal this act numerous times. 22% of Americans think that the law has already been repealed. I'm not saying that Obamacare is all negative, but most of them, it is negative. Also, as of March 2015, the estimated net cost of Obamacare's insurance-related provisions is $1.207 trillion.